Today we are going to learn about skeletal system. Skeletal system consists of 206 bones which provide support and form to the body. It protects the inner organs. It also helps in performing the movements with the help of muscles. Skeletal system is composed of axial and appendicular skeleton. Axial skeleton में आता है cranium bones, hyoid which is a small bone located at the neck, then vertebrae, sternum, and ribs. An appendicular skeletal consists of upper and lower limb. Classification based on their shape. There are long bones. Example, humerus, which is a long bone of hand. It has a tubular shape, long axis, two ends that articulate with other bones. Other type is short bone, which are cuboidal in shape. Example are carpal bones of hand. Then there are flat bones, which are flat, thin, and possibly curved. Protects internal organs. Example of these bones is cranial bones. Then there are sesamoid bones. Sesamoid means floating. So, example of this bone is patella. These bones are uh, tied in within the tendons. Then there are irregular bones. They have complex shape, just like the vertebrae of the vertebral column. Then let's see the bone markings. What are the bone markings? Bone markings allows bone to come in contact with other structures. Example, ligaments, tendons, fascia, and blood vessels. Then there are three classifications of bone markings which help in joining bones. Second is extensions and projection, and third is depressions and holes. Let us learn about them. First is depressions and holes. This is further divided in following types. First is notch. What is notch? Notch is a deep or indentation in margin of bones. Example, mandibular notch of lower jaw. Then there is fossa. Fossa is shallower depression. ज़्यादा गहरा नहीं होता, थोड़ा सा डीप. Example, iliac fossa of the hip. Then here you can see the foramen in this structure. Foramen क्या होता है? Foramen is the opening that gives passage to nerves and vessels. Example, infraorbital foramen of the orbits. So these are the foramens. As you can see in this diagram, these are the foramens. And also in hip joint iliac fossa, this is also a foramen. Foramen means opening. Then there are joining of bones. Okay, so what are different types of joining? First is head. Head of humerus is the example, which articulate with the shoulder bone. So head is a large rounded articular end of the bone which fits into the depression or fossa of another bone. Then there is facet. Facet is a smooth surface, flat or slightly curved. It articulates with another facet to form the joint. Examples are ribs. Then there are epicondyle. As you can see in the diagram, these are the epicondyle. Epicondyle are the bumps or eminence on the top or base are condyles. It forms attachment point for the muscles. Then epicondyles are above the condyles. Epi means above. So the another structure is condyles. As you can see in the diagram, these are the condyles and these are the epicondyles. Okay, so what is condyle? Condyle is a rounded articular end smaller than a head. Usually it is present in pairs. Okay, then third point is bone extensions and projections. So these are the bone extensions and projections present in the bones, different bones. First is protuberance, spinous process, spine, trochanter, tubercles, tuberosities, malleoli, lines, crest and grooves. Let's study about them one by one. First is protuberance. What is protuberance? It is protruding part of the bone. Example, as you can see in the diagram, it is a structure protruding out of the bone, मतलब बाहर निकल रहा है. As example of this is external occipital protuberance. Then there is the spinous process. Spinous process is spine like projection, obviously, as the name suggests. Example is spinous process of the vertebra. Then there is spine. Spine is a sharp, narrow process. Example, spine of the scapula. As you can see in the diagram, this is the spine of a scapula. Then there is trochanter. Trochanter is a large, blunt elevation on the side of femur. It forms attachment point for the muscles and connective tissue. In femur, there are greater trochanter and a lesser trochanter. Then there are tubercles, smaller eminence. Just like trochanter, it is present in the humerus. Trochanter are present in femur, tubercles are present in humerus. So here also there is a greater tubercle and there is a lesser tubercle. Then there is a tuberosity. Tuberosity is a swelling, as you can see. This is also a humerus. What is tuberosity? Is a large rounded elevation, forms attachment point for the muscles and the connective tissues. Then comes malleolus. It is a rounded process. As you can see, this is the joint, this is tibia and this is fibula. The processes of tibia and fibula, rounded processes, are malleolus. Then there are lines. These are linear processes present on the bone. Example, linea aspera. Then another structure is called crest. Crest are raised or prominent ridges of the bone. Example, iliac crest present in the hip bone. Then there are grooves, narrow linear depressions, houses and protects a nerve or a blood vessel. Example of this is a radial groove of the humerus, from which the radial artery and radial nerve passes. Then terms about bones. We are learning about bones, so let us discuss some terminologies of the bones. So this is example of bone. We have taken femur here. So when we divide the bone, The bone is divided into three parts mainly: epiphysis, metaphysis, and diaphysis. Epiphysis is the end part of the bone. Then there is a metaphysis. Metaphysis is the growing part of the bone. Then there is a diaphysis, which is also known as the shaft of a long bone. Between metaphysis and epiphysis, between metaphysis and epiphysis lies epiphyseal plate, which is also called as the growth plate, which allows bones to grow during the infancy and childhood and early adulthood. Then let us discuss about joints, a junction point between two and more bones. Joint is categorized based on the structure. Example: fibrous joint, cartilaginous joint, and synovial joint. Let us discuss about them one by one. Fibrous joint. A little or no movement is seen in the fibrous joint. Bones connected by the fibrous tissue. That's why the name given fibrous joint. Example are the sutures or zipper like structures in the skull. Okay, then there is syndesmosis. Fibrous joints are also classified as below. First we had discussed about sutures. Then second is syndesmosis, bones connected through fibrous membrane. As you can see, between a joint between ulna and the radius is connected by a fibrous membrane. Then there is gymphosis. Third type is gymphosis. It is a dento it is dentoalveolar syndesmosis. It is present between roots of teeth and the bony socket. As you can see in the diagram, the joint is gymphosis between tooth and the bony socket. Then there are cartilaginous joint, which typically allow slight movements. Cartilaginous joints are further divided into primary and secondary. Primary, also known as synchondrosis. The synchondrosis are joined together by hyaline cartilage. Example: epiphyseal plate and rib joint. Epiphyseal plate is temporary. As you grow older, it is filled with calcium and it ossifies. Then there is a rib joint, which is permanent type of joint as present till death. Then there are secondary cartilaginous joint, also known as symphysis, united by fibrocartilaginous joint. Example: intervertebral disc between two vertebral columns, between two vertebra. Sorry. Then there are synovial joints. Synovial joints are present. Then there are synovial joint. It is made of hyaline cartilage of articulating surface. Then it has a fluid filled joint cavity and it is surrounded by a joint capsule, as you can see in the diagram. Synovial joints are the most common type of joints. They allow free movements, freely movable, and they are classified on 6 types based on the structure and the moment. So it is divided into uniaxial, biaxial, and multiaxial. Uniaxial means allowing movement in a single axis. They are plane joint, hinge joint and pivot joint. Then biaxial are allowing movement in two axes are saddle joints and condyle. Then there are multi-axial ball and socket joint. Let us learn about uniaxial joint. First is plane between two flat bony surfaces, slightly gliding. Example, acromion of the scapula and the clavicle. Then there is hinge joint. Hinge is just like the hinge of the door. Only flexion and extension are the types of movements which are allowed in this type of joint. Example of this is elbow joint. As you can see in the diagram, this is the humerus bone, this is the radius bone, this is ulna, and the joint is formed here. Then there is a pivot joint. Pivot joint is formed from a bony process that fits into the another bone. This process this produces rotational moment around a single axis, just as the moment of saying no. Example of this is atlantoaxial joint. Then we are going to see biaxial joints. Biaxial, as the name suggests, it performs motion in two axes. Abduction, adduction, flexion and extension. Example of this is saddle joint. One convex surface fitting into a concave surface of another allows circumduction moment. Example of this is carpometacarpal joint present in the hand. Then there is condyloids. An articulating surface are UPS. Circumduction is limited moment generated in one axis. Example, metacarpophalangeal joints. Then there is a multi-axial synovial joint, ball and socket joint. Allows multi-axial motion in multiple planes, hip joint, extension, flexion, abduction, adduction, lateral and medial rotation, circumduction. Then there are accessory ligaments which strengthen and stabilize the joints, allow movements in certain directions. Then there are capsular ligaments, intrinsic ligaments, also known as intrinsic ligament, present in the thickening of the joint capsule. Example, iliofemoral ligament of the hip joint. Then there are extra capsular ligament, extrinsic ligament, which is separate from the joint capsule. Example, acromioclavicular joint have crococlavicular ligament of the shoulder joint. Intracapsular ligament, as the name suggests, it is present inside the capsule. Example of this is deep. Example of this is anterior cruciate ligament and posterior cruciate ligament present in the knee joint. Then we are going to see the blood supply of the joints. Articular arteries, branches of neighboring arteries, run in the joint capsules and form anastomosis. Then there are articular veins, accompany arteries, carries waste from the joint. Then innervation of the bones or joints. The pain sensation and the proprioceptive signals According to Hinton law, the nerve that innervates the muscle surrounding or crossing a joint also innervates the joint and the skin surrounding it.